here today to announce the presence of the first case of coronavirus disease confirmed in Nigeria. We are taking this step in order to give the clear facts to the public, which we hope you will all report accurately and be one step ahead of rumors and speculations and fabrications that tend to occupy the space, particularly social media space at this time. And the case is that the Federal Ministry of Health has confirmed a coronavirus disease case in Lagos, Nigeria, known as COVID-19. The case was confirmed on the 27th of February 2020 and is the first to be reported in Nigeria since the beginning of the outbreak in China in January 2020. It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. He actually landed here in the evening of the 24th, but by the time he got into his residence, Lagos, already 25th. He was confirmed by the Virology Laboratory of the Lagos University Teaching Hospital, which is a part of the laboratory network of the Nigeria Center for Disease Control. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure an outbreak in Nigeria is controlled and contained quickly. The Multisectoral Coronavirus Preparedness Group, led by the Nigeria Center for Disease Control, has immediately activated its National Emergency Operations Center and will work closely with Lagos State Health authorities, or let us say is already working closely with Lagos State Health authorities to respond to this case and implement firm control measures. I wish to assure all Nigerians that we have been beefing up our preparedness and capabilities since the first confirmation of cases in China, and we will use all measures and resources made available by the government to respond to this case. We have started working to identify all the contacts of the patient since he entered Nigeria, and even those who were with him on the aircraft. We have been in touch with the aircraft authority, the aircraft owners, to find out who his seatmates were. Please be reminded that most people who become infected may experience only mild illness and recover easily, but it can be more severe in other people, particularly those who are elderly and those who have other underlying chronic diseases. All Nigerians should therefore take care of their own health and maintain hand and respiratory hygiene to protect themselves, protect their families and others, following the precautions which I give you below. First, regularly and thoroughly wash your hands with soap and water and use alcohol-based hand sanitizer. Secondly, maintain at least 1.5 meters, about 5 feet distance between yourself and anyone who is coughing or sneezing. Persons with persistent cough or sneezing should stay at home and keep away from crowd, should not mix around in crowd, and should keep what we call a social distance. Make sure you and people around you follow good respiratory hygiene, meaning that you cover your mouth and nose with a handkerchief or tissue, or if you have none of these, sneeze or cough into the sleeve at the bent elbow, or use a tissue when you cough and sneeze, and dispose of these immediately. Stay home if you feel unwell with symptoms like fever, cough, and difficulty in breathing, and catarrh, and call NCDC, which is available day and night. That is Nigeria Center for Disease Control. And the number is 0809 and 7000 0010. It has been given before. Please do not engage in prolonged self-medication. Stay informed on the latest development about COVID-19 through official channels on TV and radio, including Lagos State Ministry of Health, NCDC, and Federal Ministry of Health. Citizens must not abuse social media and indulge in spreading misinformation and false rumors that cause fear and panic. The Federal Ministry of Health, through the Nigeria Center for Disease Control, will continue to provide updates and will initiate all measures required to prevent the spread of any outbreak in Nigeria. Thank you very much. That is the brief.
Let me thank you for this important briefing, which touched all aspects of the response in a more scientific aspect. Indeed, globally, the sounding from WHO is very clear. We don't know how this outbreak is going to go. While things should be stabilizing in China gradually, many countries are getting cases that have no link to China. And it means, as the Honorable Minister said, we are dealing with secondary cases, which sometimes become very difficult in terms of taking them at the airport, but they manifest when they are in the country. Right from the word to Honorable Minister, I would like to thank the government through you for having first given that leadership. We had the technical meetings through NCDC, which brought all areas of the government, departments and the ministries, but also all partners. And this answers the question of a multi-sectoral approach. Nigeria's CDC is one of the best CDC in Africa, and it is led by renowned Dr. Chipwe, who is one of the experts that WHO mobilized to visit China and advise WHO. With that capacity, you should know what direction the country is taking. We are very proud of that. You also had this meeting getting all the other stakeholders together, which you shared, a testimony that we are taking as a government seriously. Well, with all the sounding, we know this could happen in any country in Africa. But I think what is important is how do we control it, which you have alluded very well. The steps that are being laid down in terms of getting all those who were exposed during the travel and the visit of this case in Nigeria have been taken seriously. All the other partners are going to work with you. WHO has promised. Before coming here, I had the word with the regional director. He clearly say what are the urgent and immediate actions that the government will take and what support is required. This demonstrates the solidarity that is required in this kind of situation. We must be guided by facts, not rumors, and actually it's time for action. When we have situations like this, let's act together. The whole of government acting together. And I'm proud that the incident management system, which was a lesson learned from the Ebola, has been elevated to level 3 because of this situation. WHO definitely will work with you, will support Nigeria in all this process, and also work with all the other partners in ensuring that we have give people the right message, we ensure that there's capacity to really address the situation as quickly as possible, and that everyone will receive facts, not rumors. And I'm happy that the media is here. Always check facts with the Ministry of Health so that we get the real information. The social media is to help us in terms of networking, reaching everyone, but sometimes we don't have the same discipline in using it. The issue with the public health threats like this, we need to get the facts and get people the right information. People want to know what it is and how it is prevent themselves and what the government is doing. So these are the actions that we have already alluded to. So really, thank you very much.